Well, good afternoon, everybody. Good afternoon. It's 12:03, so I think we want to get started so we can keep on schedule. So, yeah. All right, good afternoon. Can you guys hear me now? Perfect. Good afternoon, everyone. My name is Henry Cunningham, and I serve as Director of Community Engagement. And welcome to our first town hall on community engagement. It's good to have you guys all here this afternoon. What we have in store for you is an update on what is happening in community engagement, as well as to hear from some of the work being done in our schools of nursing and our school of medicine. But before we do that, I want to spend some time talking about some of upcoming events that are happening. There are several professional development happening in community engagement, and I want to bring those to your attention. There is a grant writing workshop that is going on right now. It's a series of workshops. It's virtual, and so the next one is on February 9th. I encourage you to sign up if you're interested in learning how to write grants for community engaged work. There's another workshop coming up on March 5th on how to work with the immigrant community. There will be opportunities to explore what can be done to address some of the challenges faced by our immigrant refugee community here in UofL. So we encourage you to sign up for that as well if there is interest to work with this particular population. On March 22nd is the Engage Scholarship Symposium. It is an annual event. This year we will be having the symposium on Shelby campus, not campus, but out on Shelby. It's a time where faculty, staff, students, community partners showcase their community engaged work. So we encourage you to come out and hear the presentation. We also have a keynote speaker, which we hope to announce next week. I'm hoping we can confirm and announce our keynote speaker next week. And I'm sure you would love to hear this person who is an expert in community engagement and engaged scholarship, so we can learn much from them. UofL is also a member of two different organizations, the Coalition of Urban and Metropolitan Universities, the consortium of schools that look at urban metropolitan issues. CUMO, as it is called, offers a number of webinars and training exercises. These are virtual, and I encourage you to sign up for these virtual webinars that are being offered to learn more about community engagement and some of the challenges facing urban metropolitan universities. I will personally be leading a few of these trainings, so please join me as I lead some of these trainings, for institutions across the country, and to showcase what UofL is doing in this sphere of work. So I may be calling a few of you to join me as I lead my sessions in this work. There is also the Engagement Scholarship Consortium, another organization, and they too offer trainings to member institutions. So I encourage you to visit their website, look for topics of interest, and sign up for the training. They also have journals that they actually publish. So if you're interested in publication, there are opportunities there for you to publish as well. And then lastly, the CBL Institute, which is a 3-day training on how to teach a community-based learning course. So if you're interested in this kind of work, again, I encourage you to sign up for the CBL Institute. And so those are a few things that are coming up that I want to bring to your attention. When we talk about community engagement, which is an important part of the work here at the university, and there's something wrong with my slide here. Don't ask me what happened, but my slides seem to have gone out of order. I'll just have to go back and forth. I want to first talk about community engagement. What exactly is it? When we think about community engagement, it is not volunteerism, it is not service, it's really a collaboration between the university and an external entity. It's using our intellectual capital to address community issues in a mutually beneficial way. And the key terms here are collaboration, mutually beneficial. How can we ensure that this work benefits the community, but it also benefits the university, benefits faculty teaching, faculty scholarship, and student learning? We are not doing volunteer work. We are not doing charity work. And that is how community engagement differs from volunteerism and other forms of work that we do out in the community. Please pardon me here, but my slides, for whatever reason, when I upload them to this computer, the order change. So community engagement is beneficial. It serves our student, it benefits student learning, it helps them to apply what they learn in the classroom to real world experiences. It's helping them to be prepared for the real world. And so it's very, very valuable to our students. And then there are many, many other ways that it benefits our students. They learn about critical thinking, about leadership, they learn about social emotional development, about communication, problem solving. There are so many other benefits for our students who are engaged in this work. Likewise, faculty benefit, from their teaching, their scholarship, collaboration, working with their students, and developing those kinds of relationships with their students. So it also serves to benefit our faculty as well. The community benefit from this work. As universities, we are using our expertise to address issues in the community in collaboration with these partners. And so we are offering our services that benefits the community. So there's benefits for them as well. And then there's the broader impact of this work, how we are changing lives in terms of healthcare, the healthcare we provide, the impact that has on people's personal well-being and the community at large. So the community benefits, and there's impact from the work when we are engaged in community engagement. And of course, it's the goodwill that we bring to the community as well. It fosters that goodwill between the university and the community. That is something we can't do enough of. So there are many ways that as universities, as communities, we benefit when we engage in this kind of work. Okay. When we talk about community engagement, it's important that we work with partnership. We develop these partners, we maintain these partners. It's for the long haul. It's important that we do not reach out to community partners when there's a grant or there's a need for a project, but we are always in communication with our partners and developing, nurturing, maintaining these partnerships. When there are grant opportunities or there are issues to be addressed, we already have that relationship built that we can work together and get the work going. In engagement is joint decision making. So it's important that the community partner, the university, faculty are working together making decisions. This is not a case where as a university, we are deciding what is good for the community. They know their community. They know what their issues are. They can help us and guide us in this work. So joint decision making is very, very important, which again differs this work from volunteerism. When we decide what we want to go and do out in our community, makes a big difference. We also need to remember in this work that the community has assets. They are not at a deficit. They have a wealth of knowledge. They have expertise. They can help to make our work better. They can help to improve what we do. And so it's important that we perceive the community, as assets when we work out there. And then the other thing I want to say here is that impact is very important. As we engage in this work, it's important that we are able to measure impact. In what way is this work beneficial to students? Or is it beneficial to the faculty professional development? And what impact is it having on the community as well? So as you engage in this work, think about how you can measure impact. That is something we sometimes don't do as well. So this needs to be factored into what we are doing. And lastly, make sure this work is mutually beneficial. So this was a quick overview of some of the key points on community engagement that I wanted to share with you. At this time, I'm going to call Douglas Craddock to the stage to kind of talk a bit about some of the plans the university has in place for community engagement.
Yes, I'll stand right here.
Then you need this.
Everybody hear me now? We're good. So first, as Henry said, really appreciate everyone taking out time, this hour of time in your day to be here to discuss community engagement, be involved in community engagement, and continue to cultivate and elevate the work that each of you are already doing in community engagement. So shout out to you on that end. As it relates to the university, I have the pleasure, the privilege to serve as our Vice President of Community Engagement here at the university. Title in nature, but it's really the opportunity to really build on a lot of the key concepts and terminologies that Henry just put out there and allow us to really build community from a partnership outreach type of standpoint. Before I get started, I want to recognize our team members here that situates in the core Office of Community Engagement here at the university. So first we have our Assistant Vice President, Dale Griff, right here, who serves as our Dr. Duncanstein, as some of y'all may know him as well. Shout out to Griff. In addition to that, we have our Assistant Director here, Pat Smith, does a lot of work in the office. And the woman who runs the show, Susan Jenkins, she's back there doing some stuff now. She serves as our assistant to the VP. So we have other members that couldn't make it today as a part of our team. So the Office of Community Engagement, is everyone, when you hear the Office of Community Engagement, what kind of comes to mind from the university standpoint? Anything stand out? Like, oh, the office. Yeah. What's up, man? Working with some of our local schools. So that's a key initiative. That exactly is correct. Anything else? Yes, sir. Carnegie status. That's another thing. New numbers, 84 R1. Is that correct? Now, Henry? 84 as of last week. So it's 84 institutions that we're part of from an R1 status and community engaged. Anything else? I don't want to take too much time. So yeah, so we are the centralized Office of Community Engagement. It was birthed in 2007, 2008. Two former leaders, Dan Hall as well as Ralph Fitzpatrick, have led it up to this point. At one point, we were baked under communication and marketing. And then maybe about 2 years ago, we got put back into our own standalone unit as the Office of Community Engagement. Right in the middle of COVID, right in the middle when you really couldn't be too engaged from a connection, personal standpoint. And now we have the opportunity to really bring back the visibility, bring back the importance, and bring back the value, the impact that community engagement has here at the university. Another key thing that we have as a centralized unit, we have a direct line to the president day in and day out. And then from that, she's listed us as a priority for the entire university. So what that allows us to do, and when I say entire university, is all of us in this space. Many times that 2 or 3 mile distance seems like more of 100 or 200 miles between our two campuses, but it's really the opportunity, and I think that's a responsibility of our office, is to shrink that gap and make sure that we're more collaborative and we're more coordinated in the work that's occurring from a university-wide standpoint. And that's something that we've been improving on our end to make sure that everything occurring here at HSC campus is highlighted, illuminated, and illustrated already to the efforts that you're already doing even more. So within that, we have 4 buckets within community engagement that we're kind of looking at now, and the partnerships that we have. The one not in order, but education attainment. So that's a bucket. We have economic development. That's another bucket. We have health and quality of life, which occurs all around here all the time. And then we have social and human services. Each one of our partnerships and our outreach efforts will be baked into that. One thing that the president has said on too many times when we've been on tours, going to different partnerships, is many times higher education institutions will move 1,000 things an inch. More so when you could move, say, 100 things a mile. And so that's one thing that we're looking at as we really look at our partnership and our outreach efforts to determine how do we do that in an impactful way, in a way that we can measure, in a way that's mutually beneficial, and all the things that kind of existed within Henry's presentation, we do that at the university. We're currently working on a strategic plan for community engagement, in which we have our faculty liaisons have the chance to give input. So for those that may not know, each academic unit has a representative on community engagement. And it's kind of advisory board liaison, research, all things in between capacity that Henry oversees that gives us the insight to community engagement plans, the things that the academic units are doing, and how that kind of comes all the way up to the overall strategic plan for the university. In addition to that, when you think about community engagement, we have our Carnegie side. So that's a goal. We want to make sure that's input. The other thing is our signature partnership schools. We're currently working with JCPS to determine what schools do JCPS feel are needed or we should be connected to from the university standpoint. They recently redid the districting. We have our choice zone schools. Majority of the schools that JCPS want us to work with will be within that choice zone system. So we're building that out, and we get more information. We make sure that everyone's aware of that. What it looks like through and through. Then the other kind of big key item, has anyone heard of TRIO, Talent Search or Upward Bound? So that program has been at the institution for 58 years. It sits under the Office of Community Engagement, and they do great work, but a lot of people aren't aware of the tremendous impact and what TRIO does from a college access standpoint for individuals. It's a federally funded grant that students have the chance to understand college, meaning that your parents that have a bachelor's or your guardian, are you sitting on that poverty line or you're Pell eligible? So what we have the opportunity to do is to take that next level and make sure people see that these students are coming to UofL is our first hope, but having the opportunity to go to a 2-year or 4-year school across the board. So there's a lot of things happening within community engagement. Our team is really coming together to make sure that we're connecting and doing the work that needs to be done in an impactful way. And this is not the first time. I don't know if this is the first time we've done this, but this won't be the last time that we have the opportunity to come together. And it's really to make sure that the work that you are doing is seen, but also understood and heard. So people understand that community engagement is just not just a kind of value thing that people say come and go, but it's actually a value-driven proposition that we have here at the university that's just not changing lives for today or tomorrow, but we're looking to change lives for generations to come. So thank y'all for being in this space. Really appreciate the opportunity. And one thing I left off, community engagement also kind of coincides with our business work and the entrepreneurship space. So one thing that we have on April 24th, we actually have an inclusive business summit. And it's going to be an Angels Emmys Club. And it's bringing together minority-owned businesses that may seek to do work with the university or will have the opportunity to do work at the university at some point. And everyone in this space is welcome to that. But it's really kind of cultivating and building that entrepreneurship business side of the aspect around partnerships and community engagement for the betterment of the university, but also the betterment for those individuals that traditionally don't have the chance to do work with the university moving forward. So if you ever need anything from our office, we're always here to help. You'll see more of us moving forward. You have great people on this campus that are doing amazing work as well. And just thank y'all for all that y'all do. Appreciate it.
All right. Thanks so much for coming, everybody. My name is Pat Smith, Assistant Director of Community Engagement. And just wanted to talk a little bit about sort of some of the work that's a kind of a big strand of what we ask of folks out across the university community on an annual basis. And that's thinking about the information that we need from all of you to help demonstrate that we are meeting our mission as an engaged university. So, we've got kind of 3 pillars to the university mission, which is teaching, learning, of course, research, but also, this piece that is our engaged service work, our community engaged work. And in order for us to get these designations like the great Carnegie elective designation for community engagement, we need to actually have the receipts that demonstrate that we do this work. So basically, we ask annually for people to give us information about the work that they do with external partners. We kind of cast a wide net, and there's a bit of a spectrum kind of between outreach, which is maybe kind of more one and done, maybe less formalized work with your external partners or the community groups that you work with, all the way out to the other end of the spectrum, which is sort of the thing Henry was talking about, that more ongoing, formalized work that's stable, that is going to be lasting years. We want to know about all of your relationships with folks out in the community, whether that's nonprofit, whether it's with philanthropies, whether it's with governmental agencies. U of L is a metropolitan university. We have an urban service mission. We always have. But another thing, though, is that, you know, the state legislator increasingly looks to us to serve the entire state of Kentucky as well, the entire Commonwealth. And I think you can see that work happening in a lot of communities throughout the state. We also do a lot of work around the United States. We have great international programs. We're interested in all of this, and we ask all of you to help let us know about what you're doing. So I know, you know, people are constantly after you to fill out forms, to do surveys, to get more information, more assessments, like let's do another one, right? But no, this is really good information. This information does get used. We don't want to put all the burden or responsibility on you. So I'm here. I can literally, we can have a quick chat on the phone. I can fill the form out for you. You can send me links, and I can sort of excavate the written documents that you have and get those into our database. Whatever it looks like for you, we're interested in the work that you do with community partners. My name's Pat Smith again. It's pat.smith@louisville.edu. I've got cards I can hand out for folks. But really, the simplest way is just to go straight to our website, over to assessment, and then all the information's here about filling out a really sort of brief form. It's all easy now with single sign-on. You just click to sign in with login, and I get a message right away that says you went into this database, and then I approve your account. And then you're free to fill out forms. But again, I'm happy to help you anytime. But that's, again, louisville.edu/community engagement/assessment. All the information you need for that is here. And I'll be here hanging around if anybody has any questions or would like to talk to me about how we can learn more about the work that you do with external partners. I think coming up next, we have Luce and Kat, who are going to, from the School of Nursing, from the Center for Integrated Environmental Health Sciences. I almost had it. Oh, I almost had it. All right. Thank you so much. And thanks to these great speakers for coming. And thanks to all of you for coming to this event.
Teamwork. Okay. We are going to move at a nice click. So I would encourage you to look at our YouTube site. We have brochures at the top. Connect with us. This is just the beginning. I would encourage relationships with all of you in the room and anybody who's virtual. And I'm going to show you that we are a devotee of Henry Cunningham, and we are here at his church. All right. We're going to show you how we are doing exactly what Pat and Henry and Dr. Craddock have said. So our objectives are to share with you that we are here. We are an NIH funded center. We are in our first 5-year cycle. We're going to show you what we've been up to. We really are focused on Western Kentucky and Greater Louisville, but we connect with our partner, our sister center at UK, which is UK Cares. So we are trying to impact the whole of Kentucky. And then we're going to give you an insight. My colleague Kat's going to give you an insight on our Kentucky Disaster Ready Survey, which is a survey tool that we're using simply to engage communication and conversation about all of us having a little more disaster preparedness. So this is what we do. We are here to cultivate multi-directional communication with our partners in the community. We are trying to be the bridge and the interface with scientists and real people with relevant environmental health issues. So we try to reach out to healthcare providers. My go-to is always youth. So you'll see a lot of youth heavy stuff. It's just where it's my home. So that's where we always start. And then we are really trying to make an interface with our scientists. So you'll see that everything we're sharing with you, we were doing in partnership with a toxicologist, with an environmental health scientist to translate the research, make it relevant. So this is our team. No one does this kind of work alone. We have to kind of come together. And so I'd love to make a shout out to Dr. Dwayne Compton in the back too, because he is our connection and our advisor as well. So it is very much a team effort. We do, as Pat Smith has said, we do the continuum of work. So outreach, but also true citizen science that actually asks for community input and shared benefits. So here you have some illustration of us talking about healthy home environments, lead, mold, radon with young middle school ladies at Girls Incorporated in Owensboro. So sharing with them these different concepts. We did disaster preparedness with them. We talked about microplastics. We gave them bamboo utensils. They love the chopsticks. So we're trying to make these issues very relevant as they grow into adults. Mutual benefit. So we are working with Dr. Jamie Young-Wise, who is looking at PFAS contamination, per and polyfluorinated alkyl substances. Teflon is how you may know of it in a layman's term. We're worried about the environmental impact, these slow doses. We're seeing it nationwide, and we've had a particular release of it at a Teflon research recycler in Henderson. So these are Henderson youth that we've been working with. Under the guidance of Jamie Young, we went to Henderson County Science Club, and we had them collect water and soil samples. They helped us build the protocols. They went out and collected the soil and water. Great ingenuity of like using fishing line to get water samples out of deep wells in Henderson County. That's Henry talking about how they have assets and skills that can amplify our science. And then in the middle platform, you will see that is Dr. Rick Wojcik. He's the head of the National Institute of Environmental Health Sciences. And those are our student presenters right next to him. So that mutual benefit of come to Louisville, see the university, share your science that you co-created, and have a seat at the table with the director of the National Institute of Environmental Health Sciences. Mutual benefit. So we're really trying to bring this together and show that it's a back and forth sort of experience with that can benefit everyone. And we're trying to build environmental health literacy in multiple planes, acknowledging the digital divide. We need to be in written print. We need to have radio. We need to be on television. So the top corner is me doing my first Spanish webinar in Spanish. My mother would be proud, right? I'm talking about radon, okay? All right, so there's a moment for me. But we're also, when we had the pandemic, because we began in 2020, we sent out kits to our colleagues in the future healthcare providers, young high schoolers, and we did the kits virtually. So they had the kits in hand, and I worked with them to show them the results, and we tried to make that work. Now we like to do it in person because people need that connection and that face-to-face touch, but we're really working on trying to be as flexible and as adaptable as possible. Now I need to start to transition because this is Kat's forte, the social media. She's created reels. She's getting our scientists to tell their stories in layman's term and make it accessible. How do you become a science? How do you make the science relevant? And anything you see on our social media is right here. I got nothing to do with that, okay? So I'm gonna hand it over and hopefully you will connect with us in the future.
She approves all my posts before I post them. But hello, I'm Kat. So yes, I run the social media, coincide with Sarah. She just walked in a few minutes ago. She's here. So she handles more the professional side of how the center is presented, like on LinkedIn and through our YouTube. She handles that aspect of it. And then my job is more to connect us to the community, right? Making those things understandable and easy to access. And now I'm going to talk a little bit about our disaster preparedness and just kind of what that's looking like. So this is the cost of disasters in Kentucky. As you can see, they're getting more expensive and they're happening more frequently. And here we have a cool map just showing the scale of those disasters and where they're happening most common. And we have here the tornado track from the tornadoes that hit through Western Kentucky in 2021, that December. So me and Sarah actually went out to do some digital storytelling with the community members out in Mayfield this last December on the 2-year anniversary. We talked a little bit about the resilience of that community because they also were hit with the flooding this last spring, right after the tornado. So they're still recovering. They still don't have traffic lights or anything like that in the main downtown where the tornado had the biggest impact. And you can watch the video of the YouTube right there. You can scan it. We also have the QR code in the back if you want to look at it afterwards. That's some of the digital storytelling that we're doing and connecting out there. And then this is our disaster preparedness survey. So if you have not done it, could you please scan that QR code? You have a chance to win the survival kit or one of those disaster radios. And then I'll talk a little bit about what that survey is. So I'll give you all a second. You can zoom in too, it should work. Again, if not, I have flyers and can get you all some of those. So this is just some of the method for the survey. We have 11 demographics. We're recruiting participants through any way that we can, social media, emails, newsletters. And then if any of you all have any groups that we can connect with or that we could send this survey out to, I'd really appreciate it. I'm happy to talk after. And just some of our preliminary findings. I don't want to, read all of this through for you all, but 1/3 of our participants have supplies that they need. So the preliminary findings is people really aren't prepared, right? I'm sure as you guys go through this survey, you'll find, 1/3 said that they have a plan for how family members can contact each other. Think about if the grid goes down or if your cell phones no longer work and you're not home, how are you going to find your family members or connect with people? So those are things we just want to start the conversation and get you thinking about and get you talking about. And again, some of the discussion based on our findings, we really want to get a diverse sample. So again, if we could get the newsletter out or anything like that, something that we can share the survey with anybody, that would be really helpful. And it's a lot of doom and gloom. The climate crisis is not fun to talk about. So this is just some things that you can do as an individual to help with the climate crisis. And then I was going to hand out some t-shirts if anybody can tell me why one or two of these has an impact on the climate. Come on, it's fun. For which one? Yeah. So leaving your car at home, walking more, taking a bike, taking public transit. Those are all ways that you can help with the environment. I'll give you a t-shirt. Anyone else? Yes, sir. Absolutely. So like me personally, I've been trying to reduce my waste. So I just switched my shampoo and conditioner to aluminum bottles that are refillable. So I just mail them back and they fill them. Pretty cool. Yeah. So different things like that, right? And telling people about it. That's how they know, like, oh, I didn't even think about, that's a lot of waste. Like that's a lot of stuff I throw away. So yeah, I will get you a shirt as well. And then that's all we have. Follow us on Instagram, please. Any questions before I? No? Oh, absolutely. Welcome our colleagues. I don't know who's next.
All right, is this on? While he's pulling that up, that was great, guys. That was very energetic, and this is really good. Yeah, I mean, we may be calling you for our social media stuff. We got going. Just want to say thank you to everybody who's here today. This is really good. I think community engagement is one of those topics that's, it gets overlooked. But it's vitally important. And we sit in a very good place here at the University of Louisville where we can impact community. And it's something we teach our medical students as well as our residents all the time, right? That we're not just an ivory tower, but we need to go outside of these four walls and actually make an impact, as Dr. Cunningham said, so that we can make sure that we are responsible for the future that we're going to see. So with that, we'll get started here. My colleague, I'm Chris Jones. I work in the Department of Surgery, and this is my colleague, Dr. Keith Miller. He works in the Department of Surgery with me. He's a trauma surgeon. And so we're going to talk a little bit today about Future Healers and that program.
Yeah, so Dr. Jones trained me, believe it or not, so any of my shortcomings, blame him. All right. So I know I don't look young and vibrant, but so hopefully we'll try to bring the energy. But we want to talk to you a little bit about the Future Healers program. Really shouldn't be the two of us up here talking, honestly, because this is a cooperative and a collaborative between multiple different groups, including our community partner, Christopher 2X Game Changers, and the med students, which are really the engine behind this entire thing. They should really be up here talking, but you know, they're working. Me and Jones, we got nothing to do, so here we are. That's not true. We're here because this is important. So let's start with the why as we kind of talk about future healers, and I'll try to use this microphone, but this is a big problem in our community. This is a major problem, and I'm only going to bore you with 107 slides. So this is number 2. But and this study, we looked specifically at how gun violence is impacting our community from a years of potential life loss perspective. We thought about COVID, how it changed everything that happened on a daily basis. We thought about the impact that it had not only on our community, but on the world. And so this is not to de-emphasize the importance of that, which is substantial, but what it is showing you here, despite the messy graph, is that in Louisville, we lost twice as many years of potential life to gun violence, to interpersonal community firearm violence, as we did COVID-19 in 2020 and 2021. Worse yet, we'd lost at least as many years of potential life in the preceding 10 years leading up to COVID, to interpersonal violence, as we did to COVID-19. Again, not to de-emphasize COVID-19, but it's to say, hey, we got this other big problem here in our community. And we often talk about the fatality. We talk about people we lose to violence, right? But the impact is substantially beyond that. This study is based on acoustic gunshot detection system. I'm not advocating for or against it. It's got issues and all this, but it's in our city, and it covers about 2% of the geographic region of our community. All right, 2% total. And I just want you to see these numbers, because in 2018 to 19, there were 15,000 shots fired in 6 square miles in Louisville, Kentucky. Now, starting in 2021, look at that, 38,000, 39,000 shots fired in 6 square miles in Louisville, Kentucky. What I'm trying to kind of emphasize is that the impact goes well beyond fatalities. Can you imagine studying for a math test and listening to 67 rounds per day fired? Can you imagine getting ready for basketball practice, and listening to this, or trying to think about what you're going to do in the future? This is going on right here in Louisville, Kentucky. This is our city, and this is going on right here. And so this is really the why. And, I'm sorry, go back one time. And we're going to talk about the Future Healers program, but these stars on this map are kids and caregivers that are in the Future Healers program. This gray backdrop is a firearm injury, not a shot fired, an injury. We've got kids in our program where 40 to 50 people have been injured within 100 meters of their home. Again, not to belabor the point, you know this. I'm not preaching. You guys know this, but this is what's going on. This is what our kids are experiencing every day. This is the why. It's a complex problem, right? This is a big, big problem. And so whenever you get a big problem, you kind of use this socioecological. I'm a surgeon, right? So I'm using words I don't even know entirely what they mean. But here it is, right? So socioecologic model does help someone like me understand what's going on, because there's individual risk factors, there's societal risk factors. We're talking about things like just firearm access. Okay, that could be an individual level problem, but it also jumps over here to this. You talk about structural violence, you talk about structural racism. These are big things that impact risk on a daily basis to the people in our community. And so when you look at that complex problem, sometimes it's like, what are we going to do about this? What can we do about this? But, the medical model and the public health model coming together is important, because the medical model, what do Jones and I do? One patient at a time. What does public health do? Populations. Takes both of those things if we're going to tackle this problem. But that's what you're looking at. Eventually, at the fundamental level, it impacts an individual and their family. Sorry, Jones. Jones has never been a good slide mover. Somebody gets injured. Does that just impact that individual? No, we walk out in the waiting room. There's a family there. There's a community there. There's all the people that are impacted by this. I can tell you that if it's a young person, this is an adverse childhood experience, no doubt about it, right? That has impact, as you all know, on future morbidity and mortality. And then this permeates and it becomes a problem. adverse childhood experience. You all in this room know more about this than I do, but you know, the point of these two slides is that as you accumulate these, it contributes to almost every underlying disease entity you can think of, puts you at risk for everything. I mean, diabetes, heart disease, you know, this is just the trauma that's cumulative that you experience, particularly during that key developmental period of time when you're young and you're trying to figure out what this world's all about. I haven't figured it out yet, but you know, these are key points in their thing. But there are protective factors. There are protective factors. We can't change everything. We can't fix everything. But can we add a protective layer as a community, as an institution, in partnerships with community in order to facilitate this? These green checks are some things that I think the Future Healers program does relatively well. So then the goal of the Future Healers program is pretty good. I think it's an animation. I don't know. Yeah. Is to try to combat these things early. I'm not much of an animator either, obviously. So if you think about the prevention intervention continuum, we think about things like we've got our Pivot to Peace program with the Office of Safe and Healthy Neighborhoods, which is an intervention program which after you're injured by firearm, you come in the hospital, we try to surround you with resources. We try to facilitate connections in the community with the good people at Office of Safe and Healthy Neighborhoods who have a tremendous amount of programming. And that's a wonderful program. But from our standpoint in the hospital, you're down here, right? Your tertiary and your individual level stuff. Now, Ocean has all kinds of good stuff that comes up here. But the idea behind Future Healers is that it's up and to the right. That's where we want to be on an injury or on an intervention prevention continuum. Surgeons are the worst at this, right? This is where we live most of the time, down here, right? But we're trying to think beyond that. So here's the mission. You're like, well, okay, he's talking a lot about all this stuff, but he hadn't even mentioned the Future Healers program, right? What is it? What is it? Well, the mission's pretty simple. Build stronger bridges between the healthcare community and our local youth most impacted by violence, all right? To help address a public health crisis. This is the basic model, and it's a collaborative institutional community partnership working towards violence reduction, not through coming in and talking about gun violence every day. Every hour that we're sitting with these young kids, we're not saying, here's, you know, this is stay away from gun. No, the violence reduction strategy involves improving general health and well-being as a violence reduction strategy. Saying, look, let's talk about nutrition. You know, let's talk about mental health. Let's talk about cardiovascular health. I'm not an expert in a lot of those things, but guess what? At this institution, we have experts in nearly every one of those things. So it's breaking down those barriers between the community getting that information and us. So this is the partnership. It's the UofL School of Medicine, Department of Surgery, the Trauma Institute, and our community partner, which is really instrumental and key, which is Christopher 2X Game Changers. Chris and I go way back. We worked a long time together, back 15 years. I guess I came here in 2006. I remember being a young resident and I'd go up and he'd be up there working with families trying to find solutions to problems that hospitals don't have these solutions built into them at that time. 20 years ago, we didn't even think about these problems. So I've got a long history with him and he's a natural partner here. Another key component, as I said, it should be the medical students up here talking, and then I'm going to shut up and let Jones talk because he's the wise one. But the medical students are the key part. I love the first talk you talked about because now we got to try to demonstrate some evidence as to whether it works or not, right? So we're trying to get stuff out, led by Karen Udo, who actually was a medical student, and Jones can tell you a little bit about the origin story here. Came to the institution and said, how can we do more? How can we do more? And so this is the first paper kind of evaluating the feasibility of a pilot program when we had 20 kids. Here's what the program looks like, 4 to 13-year-olds. We meet monthly at the Galt House. Galt House is nice enough to give us one of their pretty ballrooms once a month, right? So we go in there. It's a safe space. The caregivers and parents are there with the kids, and we talk about all the things that I kind of mentioned before, all right? Mental health, careers in healthcare, nursing, respiratory therapy, x-ray, across the board, people coming in. We've had the Red Cross in, we've had the fire department. So, and then you talk about these things, and then we have sessions in the hospital too. And these partnerships have developed over time, and there's the curriculum. And so here's the results so far, you know, I mean, it's unbelievable. That's our trauma therapy dog. That you can never beat the dog, right? No matter how engaging your conversation is, you'll never beat the animal, right? So, but this is Surgery Olympics. This is EMS here with a big session, and it's about that's the results. Ultimately, we'll try to have additional stuff and building collaborations. These are the groups that are involved now. We've had fire, EMS, the American Red Cross, The zoo has been an instrumental partner in all this. Now there's Zoo Buddies, which is with Christopher 2X Game Changers as an extension. They go out and they get to do things at the zoo that you and I never could have dreamed of. And again, like I said, with animals, we never beat the zoo. We never put a program at the hospital and the zoo at the same time, because I can tell you where they're going. They ain't coming to the hospital. They're going to the zoo. YMCA has been fantastic. We have a session once a month there at the Chestnut Street Family YMCA. And now it's expanding. You talk about, sometimes it feels like the HSC and the campus are 100 to 200 miles away from each other. It does feel like that sometimes. Vanderbilt's only a few miles away. And so they've adopted this program and they've started it. They are calling theirs The Future Is Now. And so now it's catching on as an instrument that may be useful in lots of cities. Because I can tell you this, Louisville is not alone in experiencing this problem. This is all over our country. Okay. And so there's solutions. So this has been implemented across the country. So I'm going to let Jones talk for a little bit. I hope that wasn't too, they're asleep, I think, most of them.
All right, guys, I won't bore you much longer. I think Dr. Miller has said much of it. Thank you, my gregarious friend. So this is a really good program. We have definitely done a lot of things, and it goes back to basically we tried to hit all of the points that you talked about in your slide, right? How can we give back to the community? What are those things that people are looking for? Right. The one thing that's important, and I like for everybody to know this when we talk about Future Healers, is that Future Healers is not a babysitting program. Okay. Parents and or caregivers have to stay the entire time. Okay. And so this is educational, not only for the kids, but for the parents and or caregivers as well. Right. And it can make a huge difference in people's lives. I'll give you one example. So we had the nutrition curriculum done, and we had some of our nutritionists and dietitians and people come in and talk about healthy foods and things that should be cooked or what have you. And so literally a young girl went home and said, "Hey mom, I think this is something we should try to do." And she couldn't have been more than 7, 8 years old. And so her mom did it, and she came back the next go round when we saw her, and I asked her, "How was it? How did it go? You guys changed your diet and all?" And she told me very honestly, as kids are, she's like, "It was nasty, Dr. John." It was not something that she liked, right? But she told me, she was like, "I'm going to stick with it because this is healthy. And if it can be healthy for me and make all of my organs healthy," which she had learned about previously, "then that's what I'm going to stick with." So it makes a imprint on these young kids' minds, right, to do things, and you can change families this way. And I just think that we have to be, determined to continue to do this sort of thing. I'll tell you this last thing, and then we'll kind of get out of here. We got one last slide to show you here, but I just want to tell you, yesterday, this couldn't come at a more better time. Yesterday, I was called, a patient that I transplanted, I don't know, probably a month ago or so, came back into clinic to see me, and she brought her 8-year-old granddaughter with her. This young lady has been affected by gun violence over the last 2 or 3 years, right? The first person in Louisville killed in 2021 was this little girl's brother. The last person killed in 2023 was this little girl's sister, right? Just imagine that. Imagine that. And she knows it. She knows it. And so this is not something that we can shield, from our young people or what have you. We have to talk about it straight on, and we have to make sure that we are here to make sure that we can uplift, right, our community. And this is everybody in the community. We're always looking for help. So if any of you guys are not, busy on the second Saturday of every month, you can come and, help us with this. But I'll stop there because I think Dr. Miller did a really good job just kind of giving everybody the overview with this. But I think we got one more slide you want to share.
With this, if I can figure it out. What's space bar? I screwed it up. I knew I was going to. No, here. But here we go. I can't screw it up from here. So thank you.
So thank you, guys.
All right, thank you, gentlemen, for the wonderful presentation. What we just heard were just two of the many different community engagement projects here at the University of Louisville, and two incredible projects that are going on. So thank you. If you can just imagine the impact this university is having on the community, we are making a difference. And there's so much more we still need to do as we engage with our community out here. We at this time want to take some questions. If you have any questions for the presenters or any questions for on community engagement overall, we'll be happy to take them now. Or you may have a comment, perhaps. Yes, ma'am.
We already have lectures teed up. I just did a lecture at Jessica Eggleston's class on Belknap like last week. And then we already been in touch with Taylor Champion at Central. So they're already teed up. So yeah, just add them to the list.
No, absolutely. I think that we'd be more than willing to do that. That wouldn't be a problem at all.
Good. Any other questions? How can we check if there are people on Zoom who may have questions? People on Zoom, can they talk, or do they have to write it in the chat? As we don't want to leave those people out on Zoom out. While we're checking, any other questions or comments from people here in the audience? Questions you may have about community engagement as a whole. Yes, sir. They are also involved. Today we are featuring the School of Medicine and Nursing. We hope to work with the School of Dentistry and Public Health in another town hall. We hope to have this town hall, on a regular basis. And so we'll get them another time. I do know the School of Dentistry has the Redbird Clinic where they offer free dental services. That's been done. And the School of Public Health, by their very nature, are involved in the community in many, many different ways. I know they're working with youth and recreational services as one of their the project. They're doing some environmental health programs as well. So again, both schools are very much involved in the community. I should use the word engage in the community as well. Oh.
They'll be moving into the Opportunity Campus with Goodwill. So to be situated in a dental clinic in the West End with Goodwill, even though Norton's kind of overseeing that project, as we know, but the School of Dentistry will be there. And then, as Henry said, with School of Public Health, they were a PI with the Humana grant that we received about 2 years ago, looking at health equity innovation. So they're still stewarding that grant, doing a lot of work in health equity. One thing to add to that, we have space in the 2500 building, West Broadway, in which a lot of community partners are doing work out of that. Change Today, Change Tomorrow, which was looked at food insecurities within the West. Then also we have space at the 515 building. So that's something else that we can elaborate on at a future time, but we're building relationships in downtown. So part of the community engagement staff is actually lived or housed in the 515 building downtown. We're in the first floor. The fifth floor is the Health Equity Hub, aside Humana Innovation. And then the third floor, UofL Health takes up that space with a kind of call center, so to speak, in that end too. So a lot of amazing work going. Our office has a responsibility to make sure everyone knows about all that work that's occurring across the board. So that's something that we're working on too.
Hi, Zoom. I was just saying that everybody doesn't know where the 515 building is. So if you wanted to expand on that a little bit, might be helpful.
So the 515 building is West Market Street, right downtown next to Republic. It's the old Humana building. So Humana sits on the front. We have the space. It was kind of given to the university 2 years ago. The foundation owns and oversees the space. And then university officials, whoever the case may be, we take up space in there doing community engaged work. Yeah, Louisville's on the building.
Sorry. I had the opportunity to actually go into that building as not a UofL employee, but a community partner. And the space is very nice. It's actually open to anybody who may want to have like a meeting and things like that for free. And they have space in already for innovation, like businesses, and shared space for like sitting next to each other. You don't have space at home type of thing. So I put a plug in for the Innovation Hub.
So similar to what she said, it operates as a kind of founder space from innovation standpoint. So there's 10 founders that are housed in that space for free internet, free snacks, free workspace, free meeting space. That's part of the innovation hub itself, and the work that's built out. And then from a community partner standpoint, we have space that we have allocated to Evolve 502. So they live in that space as well. And really doing the work of scholarships and partnerships between JCPS and the university as well as JCTC. So at some point, we'd love to have everyone down in that space, maybe have a meeting there, another town hall, or something like that to illustrate the importance of that building and the work that we're doing there. So.
All right. Okay. Yes, sir. Question. Unless you want to address that.
So yes, the signature partnership, initially there was seed funding geared towards those partnerships back when it originally started. That investment kind of wavered. We're looking back and getting that back going again. So we're meeting with JCPS to determine our signature partnership schools again and what that looks like. Our key partnerships, our signature partnerships, and a lot of work that Henry and Pat and other individuals have done. We're looking at that again and what it looks like from an impact standpoint, but also identifying those true partners that we're just not naming them as partners. We're actually doing value-driven work with them and driving impact behind it. So we're working on that to kind of, I guess, reimagine it is what the initial word was behind it. So we're looking at that. You should hear more next couple months about that as well. Great question.
All right, we have time for one more question because I want to get you out of here on time. All right. If there are no other questions, thank you all very much for joining us today for the very first town hall on community engagement. Look forward to seeing you at the next town hall when it's announced. Thank you all very much and have a wonderful day.